Hello and welcome to ESG 300 Entry Exit and the ESG Assessment. I'm your trainer, HMIS System Lead Trisha Cano. The HMIS team calls this training ESG, which stands for Emergency Solutions Grant, because it's short and easy to remember. But please be aware the focus of this training is how to collect and document data in HMIS for rapid rehousing and/or homeless prevention projects. Rapid Rehousing is a program that provides financial assistance and services to prevent individuals and families from becoming homeless and to help those who are experiencing homelessness to be quickly rehoused and stabilized. Homeless prevention is a set of strategies to help low-income households resolve a housing crisis that would otherwise lead to homelessness. We will go step by step on how to correctly enter a single or a family into your project and complete the ESG entry assessment, which includes demographic data as well as income, non-cash benefits, health insurance, and disability information. And then we will work through how to complete the ESG exit assessment as well. Please note that if you have any questions, please feel free to contact us at the help desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into ServicePoint or HMIS, and how to do so was covered in the HMIS 100 class, the first thing you should do, especially in rapid rehousing or homeless prevention projects, is to get into enter data as mode to the correct project, because most providers have multiple projects that they work with. So in the upper right hand corner underneath your name, find the link Enter Data As and click on it. You will see a list of projects that are available to you. For training today, I made the list short and sweet, but please note that your list may be much longer than this, and you may need to choose not just between rapid rehousing or homeless prevention, but which county the client is residing in as well. For my example today, for my first client, I'm going to use ESG Rapid Rehousing in Apache County. So I'm going to choose that one by clicking the green plus sign next to the project. And then you'll notice in the upper right-hand corner next to Enter Data As, there's now a blue hyperlink that says ESG Rapid Rehousing Apache. You want to be sure this is turned on before you start entering data on your client so that all the information you gather, both assessment and services, is attributed to the correct project. Next, say to yourself, do I need to be in backdate mode? Backdate mode is when the services or the information that you're entering didn't happen today. They happened someday in the past. And this is often the case. I am going to go ahead and I'm going to click on the backdate mode link and get into backdate mode. I'm going to go way back in time. Whoops, I forget I have to change the year first. I'm going to go way back in time just for demonstration purposes, but please note that the HMIS policies and procedures say that all data must be entered within 7 business days of the interaction with the client. So you put in the date that the interaction happened, and in this case, I'm going to say that the client entered the project on October 5th, 2015, and then click the Set Backdate button. When you're in backdate mode, your banner will change to a bright yellow color, and it will remain in this color until you exit backdate mode. Next, I will go to the client menu bar and I'm going to search for the client that I want to enter into my project. So you click on Client Point on the menu bar on the left, and you search for the head of household or the single client that is entering into your project. So I'm just going to put a test client in for demonstration purposes. Please answer all of these questions, because if this client has never been served before, you're going to have to answer these questions anyway. So what's the name data quality? Is it the full name reported, partial street name or code name, client doesn't know, client refused, or data not collected? It's usually one of these first two. So I'm going to say full name reported. Alias, if there's any aliases that your clients go by, or if you have a woman with a maiden name, something like that. Social Security number. So what is the client's Social Security number? If you do not have their Social Security number, don't put all zeros or all ones, just leave it blank. And you can also just do the last four if that's all they're willing to share with you. And then you must choose the Social Security number data quality. Was it the full social reported? Was it an approximate or partial, which is the last four? Client doesn't know their social, client refused to give you their social, or data not collected. And data not collected means that you didn't even ask them for their Social Security number. So in this case, I'm going to put full social reported. And then, is this client a military veteran? Yes or no? Do not use this exact match button because it will look for a client that looks exactly like this. But if your client was already in the system, but one number is off on the social or their name is slightly misspelled, they won't show up in your search results. So don't use exact match. Once all of this is completed, click your search button. And you would look at the bottom under client results for a list of clients and see, is your client already in the system or not? They often are, and if you can see their name, then you would just go ahead and click on their name or the pencil next to their name to use their record. Please do not create a duplicate record if you can avoid it. If you see a client with a similar name but you're not sure if it's the same one, then go ahead and create another record, and if we discover in the future that they were the same client, you can contact the HMIS help desk and we can merge those records together. But for today, you can see that my client has never been in the system before. So I'm going to go ahead and now click on the button that says Add New Client with this information. And it's asking me to confirm that I did a thorough search and I really want to add a new client. And so I will click OK. And it will take me to the client's profile. Some agencies, the default is the Summary tab. And that's okay. If it is, just go ahead and click on Client Profile to get to the same page that I am on right now. Now, before I get into showing you how to actually create the entry exit on your new client, let's just talk a little bit about the client record and what all the different sections and tabs mean. First of all, the client record at the top is where is housed the client's name, social, and veteran information. If you needed to correct the spelling of the name or fill in the social or answer the U.S. military veteran question because you forgot to answer it on the client search screen, it can be also done right here from the client profile by editing the client record. So find client record and click on the edit pencil to open it, and here's where you can correct name, social, and answer the U.S. military veteran question. Also to the right is where you can upload a photo of the client if you have one. Underneath client record is the client demographics. This will always be blank for a brand new client because we haven't completed the assessment yet. As soon as we complete the assessment from the Entry Exit tab, then this client demographic information will automatically fill in. Please do not ever complete the client demographic information from this screen. Do not click on this pencil and fill in date of birth, gender, race, ethnicity. These questions should be answered on the assessment. And I will show you that in a few minutes. Underneath that, you have a place where a custom assessment can be attached. Not all providers have a custom assessment. Some providers have the AZ Client Notes function here. And AZ Client Notes is covered more in the Case Management 200 series. This client notes section is a very generic client notes, and most providers do not use it. File attachments is where you can scan and upload an electronic copy of client information, such as photo IDs, birth certificates, releases of information, things of that nature. There is a required format for the files that you save to file attachments, so please see your HMIS policies and procedures for that formatting. And finally, you have the incidents section. Not all providers use this, but this is a way for everyone to be on the same page within the agency on any incidents that may have happened with the client, such as any non-compliance with rules, things like that. If I scroll back up, let's go over the tabs. As I stated, sometimes when you log in, you will default to the Summary tab. And what's available on the summary tab is somewhat customizable. So if you wanted something else to show, please contact the HMIS Help Desk and we can assist you with that. The Client Profile tab, which is where we were just working. Next to Client Profile is the Households tab. And this is where if you're working with a family or a couple, you would create a household and group those clients together for the purposes of having them connected within the entry. If it's a single, then you don't need to worry about anything on this tab. The EntryExit tab, which is where you'll spend the most time, this is where you create the actual entry into your project, answer all the assessment questions, do any updating to the client's record over time, and then finally exit the client from your project. The Case Managers tab is where you can assign yourself as the client's case manager. This is covered in the Case Management 200 series. And the Case Plans tab is where you can set up goals. This is an electronic service plan. And again, if you want to utilize this feature, it is in the Case Management 200 series. Then you have the Measurements tab. And this is where you can add a measurement such as the Self-Sufficiency Matrix, the SPDAT, or the FSPDAT case management tools. And then behind EntryExit, you have this tab, Service Transactions. And this is where you record services and or referrals for your clients. Clients in Rapid Rehousing and Homeless Prevention require you to record the services provided. So this will be covered in the ESG 302 class shortly. Now let's go back over to the client information page. And I'm going to go to the client profile so that it looks like what it would have looked like if you had just found your client or created your client in the system. Now, the first step, once you've created your head of household or your individual client, is to create your household if you're working with a family. The example client that I'm going to work with today will be a family because creating a household and entering an entire family into your project is more complicated than just doing a single individual. So that is the example I'm going to use today, but keep in mind I will point out the differences between individuals and families as I go. So now that I have my head of household, I need to create the household grouping. So I'm going to go to the Households tab next to the client profile, and I'm actually going to show two different scenarios for households. The first one is the client has no household whatsoever and you're creating it from scratch. Keep in mind, sometimes when you use a client record that had already been established, they will also have a household that is already established, and you will need to check it, verify it, and make any changes as necessary. And I will show you that in a few minutes. But first, let me show you the scenario of where the client has no previous household even started. So you click on the Households tab, and then you click on Start a New Household. You need to choose the household type at the top. So is this a couple with no children, extended family unit, a female single parent, foster parents, grandparents and child, a male single parent, a non-custodial caregiver, some other, and two-parent family. So in this case for training today, I'm just going to say that this is a single female parent. And then in this client search area is where you're going to look for the other members of the family. So this would be, in this case, her children. If it was a two-parent family, you would look for, say, her spouse and then the children in the family, etc. So I'm going to say, just keep it real generic for training. I'm going to look for a child, full name reported. Do I have the child's social security number? If I do, enter it in. If not, leave it blank. And then choose the Social Security data quality. Do I have the child's full social? Do I only have an approximate social? Did the parent not know the child's social, or did the parent refuse to give me the child's social? So I'm going to say the full social was reported for this child. And the U.S. military veteran, you don't even have to answer this for children under 18, but you could say no as well. It doesn't hurt. So I will do a search for this child in the system. And under client results, I have no matches. This name down here, this is my head of household who I've already put in. But under results, I have no matches. If the child was already in the system, they would populate here and you could choose them by clicking a green plus sign. But my client's child has never been in the system before, and so I'm going to click Add New Client, as in this new child with this information, and confirm. And once I do that, it pulls that new child down here and groups it with my head of household under Selected Clients. I would continue to do this until every member of the family was added, no matter how large the family. For training purposes today, I'm just going to keep it at the two, a female single parent and her child. So once everyone in the family is added and you have the whole family listed here, then you click the Continue button. And on this page, you're going to tell the system who is the head of household and what is the relationship of all the other members to that head of household. Also ensure that your joined household date is at least the entry date into your project or earlier. The joined household date should not be after the entry date. So I'm going to find my head of household and change this head of household no dropdown to a yes. And when I do that, the relationship automatically defaults to self, so don't change it. This is correct. And then I'm going to look at every other family member and say, what is this family member's relationship to my head of household? In this case, I'm going to say it's her daughter. You can see there's a long list to choose from. It can be a daughter, it can be a son, it can be a spouse, it can be a significant other, etc. And I again ensure that the joined household date is my entry date or earlier, and it is. So I can just click Save and Exit. I'm done. And you've created a household for this family. The other scenario I'm going to show you is, let's say, I'm going to go look up a different client. Let's say your client was already in the system and you're using an established record. And you go to the Household tab, and there's already a household there. What you do in this case is you review the household. Is it still the same? Are the same members still in it? Things like that. If something has, and if everything is the same, you're good to go, move on to the next step. However, if something has changed, like they had another child, let's say, or someone has left the household because they're no longer together, I'm going to tell you what to do in that scenario. So let's pretend like this woman, her and her husband have separated, and in the meantime, she just had a baby. So I'm going to Manage Household, click the button that says Manage Household to make some changes. And this said female single parent, but it really should have said two-parent family, but we'll say we changed it to female single parent. And then we're going to add another baby in. So to add someone to this grouping, click this Add or Delete Household Members. And then to add clients to the household, as in another child, expand this arrow to open up your search screen. And you search for another baby. So let's see. Baby testing, full name. Client doesn't know the social security number yet. Search. There's no matches. So I'm going to add this client with this information. Pulls it down into my selected, and then when I click continue, this new baby is added to the family. See that? It went from 4 to 5. And I will say that this is another daughter in the day that they joined, and this is fine this day. However, let's say if the woman has separated from her husband, you don't need to remove him from the household because you never know, they might get back together. Who knows what could happen in the future. You can just leave him in this household, but then when you go to create your entry, you would exclude him from the entry. And I'll show you how to do that in a few minutes. So click Save and Exit, and this household has been corrected to add a new member. So let me go back to my previous client I've been working with. And the next step, now that we've created our household, and like I said, if this was a single, you would skip the household creation. And we're going to actually create the entry into our project. So you're going to click on the EntryExit tab, and you're going to find the button that says Add Entry or Exit and click on it. And when you click on this and it's a family grouping, you're going to see your family up at the top. And here is where you can include or exclude different family members. So if this was that large family I was working with earlier, I would just check mark everyone who's entering Rapid Rehousing on this day. If someone wasn't, such as the husband, I would just leave the name unchecked, and it will not create an entry for them. In this example, I do want to include both the head of household and her daughter. I will ensure the provider is correct. This should default to whatever you're in Enter Data As mode to. If it does not, that means that you're not in Enter Data As mode, and we highly suggest that you cancel and get into Enter Data As mode and start again. Then you choose the type, which will always be HUD for Rapid Rehousing or Homeless Prevention, and then you ensure the entry date is correct. The entry date auto-populated to 10/5/2015 because I am in backdate mode to 10/5/2015. If it did not auto-populate to the backdate you need, that means that you're not in backdate mode, and you should cancel and get into backdate mode first. But everything here is correct, and so I will go ahead and click Save and Continue. By clicking Save and Continue, I have now entered both my head of household and her child into my project as of 10/5/2015. And the default assessment, which is the ESG entry assessment, and remember ESG just means Rapid Rehousing or Homeless Prevention projects in this case. The ESG entry assessment opens and we complete it. Now let's go through the ESG entry assessment for the head of household, and I will show you how to answer these questions. This would be how you answer them for, like I said, the head of household of a family or a single individual. The first question is the date of birth. So what is your client's or your head of household's date of birth? And you would put in 2-digit month and day and then a 4-digit year. Date of birth type. Was it the full date of birth reported? Was it an approximate or partial date of birth? This is usually only used for outreach teams. Most times you will be using the full date of birth was reported. Then what is the client's primary race? American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, client doesn't know, client refused, data not collected. If you're not sure what these mean, you can hover on their primary race question and it gives you the HUD definition of these different races. The next question is optional, secondary race. Only fill this in if they report to you that they have a secondary race. If they do not, leave it blank. Then we have ethnicity. Again, if you hover, it gives you the definition. So are they non-Hispanic, non-Latino, Hispanic, Latino, client doesn't know, client refused, data not collected. What is their gender? Female, male, transgender male to female, transgender female to male, other, client doesn't know, client refused, data not collected. If you choose other, you must type in the other gender reported below. We will choose female for this scenario. Does the client report a disabling condition? If you're not sure what that means, again, hover on the question and you will get the HUD definition of a disabling condition. Yes or no? I'm going to say no. Residence prior to project entry. This is mean where did this client sleep the night before they're entering your project? An emergency shelter, foster care or foster care group home, a hospital or other residential non-psychiatric medical facility, a hotel or motel paid for without emergency shelter vouchers, jail, prison, or juvenile detention facility, a long-term care facility or a nursing home. They came from owned by client, no ongoing housing subsidy, owned by client with an ongoing housing subsidy, permanent housing for formerly homeless persons, a place not meant for habitation. This can be the streets, the woods, an encampment, abandoned buildings, their cars, a psychiatric hospital or other psychiatric facility, a rental by client with no ongoing housing subsidy, a rental by client with a VASH subsidy, that stands for Veteran Affairs Supportive Housing, rental by client with GPD TIP subsidy, this is also a VA or veteran project, grant per diem, transition in place, or rental by client with other ongoing housing subsidy. And other subsidies can be, for example, Section 8 or another Rapid Rehousing project. A residential project or halfway house with no homeless criteria, a safe haven. This is a project specifically for people with serious mental health. Staying or living in a family member's room, apartment, or house, staying or living in a friend's room, apartment, or house, substance abuse treatment facility or detox center, transitional housing for formerly homeless persons, other. Client doesn't know, client refused data not collected. If you choose other, you must type in the other residents below. However, this is a very comprehensive list and others should be used sparingly. And if you're not sure how to categorize the residential location your client reported to you, please feel free to call the help desk and we will help you do that. In this case, I'm going to say this client and her daughter were staying in an emergency shelter at least the night before they're being entered into this rapid rehousing project. Then we have length of stay in previous place. This relates directly to the question above about where were they prior to project entry. So for whatever answer you chose, in this case emergency shelter, how long were they in that emergency shelter? 1 day or less, 2 days to 1 week, more than 1 week but less than 1 month, 1 to 3 months, more than 3 months but less than 1 year, 1 year or longer. I'm going to choose more than 1 week but less than a month. Then we want to know what was the zip code of their last permanent address. And last permanent address means where did they reside for 90 days or more. So keep in mind this may not be what you put above for prior to project entry. It says where were they living, housed for at least 90 days or more. You would put in the zip code. However, if you have a client who cannot tell you the zip code, they don't remember the exact zip code, but they can tell you the city or the county they were living in, that's fine. We have provided a generic cheat sheet if you hover on the question that you can use one of these zip codes instead. 85936 is for Apache County. If the client knows the zip code, please use the correct zip code. The cheat sheet should only be used when the client cannot remember their exact zip code. Then we have relationship to head of household. Well, this is the head of household, so we're going to say self. If this was a single client we were working with, we would also fill this in with the word self. Client location. There's only one option, so you can only get this wrong by not choosing it. This is the COC code. This is the Continuum of Care code for the balance of state. So it's AZ500. You should put this every time. And then what's the homelessness primary reason? What does the client report to you as the main reason that they're ending up homeless? Alcohol abuse, bad credit, the client doesn't know, the client is not homeless, and this should only be used for homeless prevention or diversion projects. The client refused to tell you, criminal activity, the data was not collected by the interviewer, divorce, domestic violence, eviction, fire or disaster, health or safety, they moved to seek work, loss of childcare, loss of job, loss of public assistance, loss of transportation, a medical condition either in the family or with themselves, mortgage foreclosure, no affordable housing, other, overcrowding or a family dispute, physical or mental disabilities, poor budgeting, release from an institution, release from jail or prison, release from a mental health facility, substance abuse, substandard housing, unable to pay rent or mortgage, underemployment, low income, or utility shutoff. So I'm going to choose eviction. And then we have the section titled Length of Time on Street in an Emergency Shelter or a Safe Haven. It's very important that this is filled out for every adult in the household. It helps us determine whether the client meets the definition of chronic homelessness or not. So the first question is the client entering your project from the streets, an emergency shelter, or a safe haven? Answer yes if the client is entering your project directly from a place not meant for habitation, an emergency shelter, or a safe haven. Answer no if the client is entering your project from any other location. Note that diversion or homeless prevention projects should always choose no. But let's look up here. Where did we put for where they slept the night before? We said an emergency shelter. An emergency shelter is one of the criteria, so we can say yes to this question. The next question, if you said yes for clients entering from streets, ES or SH, the approximate date that it started. So note that it says if yes. So if you answered no to the question above, then this date should be left blank because it does not apply. But because we answered yes, then we need to have the client look back to the date of the last time they had a place to sleep that was not either on the streets, in an emergency shelter, or a safe haven, and put that date in this date field. The date can be an approximate date, so if they don't know the exact day, that's okay. Just use the month and year, and then the actual date here can be the date of their entry into your project. For example, they're entering your project in October, but they tell you their homelessness started in May. So then you can put let me just go ahead and put it. You could put May 5th, 2015, because their entry date to your project is October 5th. The next question, regardless of where they stayed last night, number of times the client has been homeless on the streets, ES or SH, in the past 3 years, including today. So this is how many episodes of homelessness have they experienced in the last 3 years, even if they're not coming to you this time directly from the streets, ES or SH. So your options are never in 3 years, and this should only be used for homeless prevention or diversion projects. 1 time, 2 times, 3 times, 4 or more times. So in this scenario, we're going to say 1 time because this is the first time this client has been homeless. Then the total number of months homeless on the streets in the past, streets, ES or SH, in the past 3 years. This is the accumulated number of months they've been homeless in the past 3 years in one of these 3 places. This question is very important for determining the new definition of chronic homelessness, so please do not skip it. If this is a homeless prevention or diversion project, you can, of course, not answer it because it does not apply. But for rapid rehousing and any other project, you would put at least 1 month because this is the first time they were homeless, or some other answer of their accumulated amount of homelessness over the past 3 years. And then was the status documented, yes or no? Now, those were the universal data elements. Now we're going to talk about the program data elements. The first one is total monthly income. So does this client have any income coming in? Let's say they have an income, but it's a small income. So they only have about $500 coming in per month. So the answer, if they had nothing coming in, please put a 0. Don't just leave it blank. I'm going to put 500. Income from any source, yes or no? I'm going to say yes. And then you have to list the sources, each source that HUD recognizes, and whether they receive that income, yes or no, and how much if it's yes. So the fast way to do this, instead of clicking add, add, add for every single source, because there are 15, it's much faster to just use your HUD verification link over here on the right. Please note that rapid rehousing and homeless prevention projects are required to use the HUD verification process since they are usually funded by at least one of the federal partners, including HUD. So you will click the HUD verification link on the right, and it will list the 15 sources of income. And you have to document yes or no whether the client has each of these incomes. Now, if you know ahead of time that the only income they have is this earned income of $500, you can use this shortcut up at the top where you can choose the same answer for every question and then just change the one that's different. So for instance, I'm going to say no, which made all of my income sources be no, the client is not receiving. But I'm going to go back to earned income and I'm going to change it to a yes because she is receiving a little bit of earned income. When I click yes, then an additional screen will pop up so you can put in the amount of the monthly income they're receiving. In this case, $500. The start date being the day they entered your project is fine. You don't have to go back to when they actually, started working at this job. The entry date is fine. Click save and then save and exit at the bottom. And now my HUD verification turned from a red triangle to a green check mark, and that's what I want to see. The next section is non-cash benefits. Is my client receiving any non-cash benefits? And this can be things like food stamps or WIC. So I'm going to say yes, they are, and I'm going to use my HUD verification. I'm going to do my shortcut of saying no to everything, but then changing food stamps, because I'm going to pretend that my client is receiving food stamps, to a yes, and save and exit. And now my HUD verification is green. And then I have covered by health insurance. Is my client covered by health insurance? Yes or no? I'm going to say my client is on access. So I'm going to say yes. And I'm going to use my HUD verification to make it fast. And I know the only thing they have is access, which in this case is Medicaid. Medicaid equals access in Arizona. So I'm going to say no to everything, but change Medicaid to yes, save and exit. And finally, I have to say, does my client have any disabilities? And if they did, what types do they have? Well, I said up above that my client did not report any disabling conditions, but I still have to do my HUD verification and say no to each of the types listed. So I can do my shortcut again that says no. But I'm going to show you, just in case you have this happen where a client does have one or more disabling conditions reported, this is what it would look like. You would say yes to the disabling condition that they report, and you can do more than one. So let's just, for example, say physical. When you click on the yes, it opens another screen that you have to complete these remaining questions. So if yes is expected to be of long, continued, and indefinite duration, is a disability severity on file? These two questions are for PATH teams only, and you can skip them. And then, are they currently receiving services? Yes or no? And is it going to be long-term, yes or no? And then you would click Save. This was just an example of how you would fill it out if the client did report one or more disabilities. But my client doesn't have any in this scenario, so I'm going to click Cancel. And I'm going to click No again and Save and Exit. And then we have these last few questions at the bottom. So is this client currently in school or working on a degree? Have they ever received vocational training? What's their highest level of education that they've attained? I'm going to say they have a GED. And are they a domestic violence victim or survivor? I'll say yes. If you say yes, when did the experience occur? I'm going to say more than a year ago. And if yes, for domestic violence, are they currently fleeing that situation right now? I'm going to say no. If I had said no, they are not a domestic violence victim or survivor, these two questions can be skipped because they don't apply. Then finally, these last two questions at the bottom, first of all, only apply to rapid rehousing projects. And second of all, must be answered on everyone in the family, adults and children alike. So what this question means is, has the client moved into permanent housing yet? Well, usually with rapid rehousing, that takes some time. You enroll the client in the project, but it could take up to 30 days to complete all the paperwork and search for an apartment, and then do more paperwork and actually get them moved in. So 99% of the time, when you're creating this entry, it's really the enrollment, and so this answer is going to be no. They're not in permanent housing yet. And since the next question says, if yes, data move in, we're going to leave it blank because we said no. And this is something that we will need to update as soon as the client does move into an apartment. And I will show you how to do that in ESG 301, how to do interim updates, okay? So if this was a single individual, I would be done and I could click Save and Exit and move on. But because I am showing you a family, what I need to do is just click Save so that it doesn't close. And I need to scroll up to my list of family members over here on the left, right where the entry assessment starts. Everyone in the family will be listed. And now I need to do the entry assessment on each person in the family. As I mentioned before, different client types need to have different questions answered. So please refer to your cheat sheet that we provide in your training confirmation email. In this case, I'm going to show you quickly how to go through a child ESG entry assessment. So I'm going to switch to my child's record by clicking on their name. And you'll see how the ESG entry assessment went blank, and that's because now I'm on the client's record and I have to fill in their information. So first, what's the child's date of birth? What's the date of birth type? Full date of birth reported. What's the child's primary race? Does the child have a secondary race? If not, leave this blank. What's the child's ethnicity? What's the child's gender? You do not have to answer the disabling condition question for children. However, if the child does have a disabling condition that's reported and you want to document it down below under disability types, then you should answer this yes. But if they do not have one, you can leave it blank. You don't have to answer any of the previous residence information, but we do have to go to relationship to head of household and answer this for every person in the family, including children. So in this case, this would be the head of household's child. I don't have to answer any of this homeless reason or length of time on streets for children. I don't need to answer income or non-cash benefits on children, but I do need to answer health insurance and disability types for children. So under covered by health insurance, I'm going to say yes or no, does the client have health insurance? Well, the mom reported that her family was on access, so I'm going to say yes, and I'm going to do my HUD verification. Yes, even children have to have the HUD verification if the question is required. So I will say no to everything but access or Medicaid. Save and exit. And then does the client's child have any disabling conditions? If they don't, just like the mom, I still have to say no to each type and click save and exit. I don't have to answer any of the educational or domestic violence questions on children, but I do have to answer, if this is a rapid rehousing client, the in permanent housing question, because remember I said this must be answered on every household member. So they have not actually moved into an apartment yet, so I'm going to say no and save. You would continue to do this, moving down your list of clients until everyone in the family has an assessment completed. Once everyone in the family is completed, then you can click Save and Exit at the bottom. When you click Save and Exit, you will be directed back to your EntryExit preview pane, where you can view the entry you just created, the date you created it, and the clients that are in this entry. If you click on this, it actually tells you the name of the clients and the day that they entered. So here's my mom and her child. And to show you that the questions we answered on the assessment auto-populate into other areas of the client profile, I will click on the Client Profile tab, and now you will see that the client demographic information has filled in automatically. And that's because we filled it out on the assessment through the EntryExit tab, just the way we were supposed to. And that is how you create an entry for your client or your client and their family in rapid rehousing or homeless prevention, depending on the project that they're in. Now, the final thing that I'm going to show you for ESG 300 training is how to exit your client and or their family from your project. So let's say that a couple months have gone by, the client's is in an apartment and they're stabilized and you're going to exit them from the project. And I realize that sometimes it's more than just a couple of months, but just for the sake of this demonstration, let's say a couple of months went by. So I'm going to get out of backdate mode by going in the upper right hand corner and turning it off. You can click the little red X next to that backdate date to make it go away. When you log in, make sure you get into your, in fact, let me go to my home screen. When you log in, make sure you get into your Enter Data As mode to the project your client was being served from. And then you would look up your client in Client Point, or your head of household if you're working with a family, and you would create their exit. Now, if they exited a few days ago, then you would use backdate to the day that they actually exited. But in this scenario, I'm going to say that the client is exiting today. So I'm on my head of households record, and I go to the EntryExit tab, and now I'm going to create an exit for this client or this client and their family, depending on who you're serving. So from the EntryExit tab, you find the line of entry into your project, and you have to be careful because sometimes a client will have more than one project listed here, and you need to be sure and choose the correct one. So I'm going to go for Rapid Rehousing Apache, and they entered on 10/5, but they're leaving today. So right next to the exit date column, there's a pencil that says Edit Exit. So I'm going to click on that pencil to create the exit. If you're working with a family, be sure to check mark everyone who is leaving. Don't leave the children behind in the project accidentally. And then you choose the exit date. And since I'm saying that this client and her child are exiting today, I'm just going to leave it with today's date. Next, I'm going to put their reason for leaving. Is it completed program, criminal activity or violence, death, disagreement with the rules or persons, left for housing opportunity before completing program, needs could not be met, non-compliance with program, non-payment of rent, other, reached maximum time allowed, or unknown disappeared. Well, I'm going to say my client got into an apartment, so they completed the program. And then I have to put destination, like where are they staying now? Where did they go to? This list is very similar to the residents prior to project entry list, so I'm only going to point out the differences. So for destination, they've added in deceased. They've added in move from one HOPWA funded project to HOPWA permanent housing and move from one HOPWA funded project to HOPWA transitional housing. Whoops. And HOPWA stands for Housing Opportunities for Persons with AIDS. They have added in also staying or living with family temporary versus permanent, staying or living with friends temporary versus permanent, and they've added in no exit interview completed. But my client went into a rental with a subsidy, right? Because it was rapid rehousing. It's going to say rental by client with other ongoing housing subsidy. Actually, I'm letting them go. I'm not supporting them anymore. Sorry about that. It'll be rental by client, no ongoing housing subsidy, because they're being exited from the rapid rehousing project and they're going to pay their rent on their own now. Then click Save and Continue. And the system created an exit date, a reason for leaving, and a destination for every person in the household. And that's how we want it to look. And then we have to complete the ESG exit assessment. And we would just make any last minute changes to the data. Also, if this was a homeless prevention client, here is where we would have to fill out the housing assessment and exit. So were they able to maintain the housing they had at project entry? Or did they have to move to a new housing unit? Did they end up moving with family or friends? Did they end up becoming homeless? Did they go to jail or prison, etc.? And then if they were able to maintain the housing that they had at entry, what kind of subsidy information do they have now? Without a subsidy, with a subsidy they had at project entry, with an ongoing subsidy acquired since a project entry. And then, sorry about that. And then if instead they had to move to a new housing unit, what's that subsidy information? So these two are an either or. You wouldn't answer both. You'd answer one or the other, depending on the answer above. Did they maintain their housing or did they have to move to a new unit? This only needs to be answered for homeless prevention clients, not rapid rehousing. So once you had updated any information that may have changed as they're leaving your project, you click Save and Exit, and that's all there is to it. Now your client or your client and their family members have been exited from the Rapid Rehousing project. This is how you create an entry and an exit to Rapid Rehousing and or homeless prevention. Obviously, there are many more steps involved. There's the need to update the record over time if they get a better job or they lose or gain benefits. There's the obligation to update the day that they actually moved into their permanent housing. And there's also the need to record services that are provided to that client, such as case management and rental assistance and utility security deposits, things like that. And those will be covered in the next two training courses, ESG 301 and ESG 302. For now, let's go over a summary on what we covered today so that you can do well on your quiz. So that'll be this. Let me pull it over here. All right, so here's a summary of ESG and or Rapid Rehousing Homeless Prevention training that we covered today. So number one, according to the Balance of State HMIS Data Quality Plan, you must enter clients into the system within 7 calendar days. Number two, the U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. Number three, when creating a household, you must go through the Households tab. Number four, there can only be one person designated as the head of the household. Number five, when creating an entry, you must go through the EntryExit tab. And number six, client demographic information should always be recorded on the EntryExit tab through the ESG entry assessment. Number 7, HUD considers zip code of last permanent address to be where the client was housed for 90 days or more. And number 8, remember these points when completing that length of time on streets, in an emergency shelter, or a safe haven section. Only answer yes to the first question when client is entering your project directly from the streets, an emergency shelter, or a safe haven. The exception is that they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. For example, if their entry date to your project is October 3rd, 2015, but they only remember their last episode of homelessness starting in May sometime, then you can put a start date of May 3rd, 2015. Count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven this time. Only use never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. And finally, add up the accumulated months of homelessness during the past 3 years where the client was either living in the streets, in an emergency shelter, or a safe haven. And keep in mind, any single day or part of a month counts as one full month for this question. Number 9, if a client enters with no income, put a 0 in the total monthly income text field. Don't leave it blank. Number 10, remember all federal partners must use the HUD verification workflow in HMIS. This includes ESG. Number 11, in the state of Arizona, access is considered Medicaid for reporting health insurance. Number 12, when creating an exit, be sure to go through the EntryExit tab and use the Edit Exit pencil icon to exit your client or their family from your project. And number 13, when working with a homeless prevention client or family, be sure to answer the housing assessment and exit questions on everyone in the household, not just the head of household. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmisupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.